Hi, my name is Joanne Sampolsky, and I'm going to share my screen with you. Okay, today I'm going to discuss opioid use disorder, heroin. So what is heroin? Heroin is an opioid drug made from morphine. It's a natural substance taken from the seed pod of the opium poppy plant. It is grown in Southwest Asia, Mexico, and Colombia. So heroin can be a white or brown powder or a black stick substance as black tar heroin. So heroin, the route of use, it can be injected, sniffed, snorted, or smoked. It can be sometimes mixed with crack cocaine, and this practice is called speedballing. So the history of abuse. In the mid to 1800s, opioid dens became popular due to drugs being brought in by the immigrants who were working on the railroad. They packaged this as laudanum, which was administered to kids and adults to treat a variety of illnesses. It was also used to treat alcohol withdrawal, which was more prevalent back in that time. And during the Civil War, related injuries skyrocketed, with tens and thousands of soldiers becoming morphine addicted. And in 1874, Germany invented a new drug called heroin, which increased the problem of addiction. So heroin, morphine, and other opioid derivatives were unregulated and sold legally in the U.S. until 1920, when Congress recognized these drugs as dangerous. So they made a new law, the Dangerous Drug Act, which made the purchase of which made over-the-counter purchases illegal. But by that time, there was over 200,000 heroin addicts, and this trend continues today. From 2019 to 2020, heroin use has increased among all people ages 12 or older. A large majority of heroin users first misused prescription opioids. Over 900,000 Americans use heroin annually, and 6.2 million Americans will use heroin at least once in their lifetime. So heroin makes up 4.5% of all illicit drug use in the lifetime of Americans 12 and older. So I found this slide and I wanted to share it with you. So heroin is part of a larger substance abuse problem. Nearly all people who used heroin also used at least one other drug. So this is saying people who are addicted to alcohol are 2 times more likely to be addicted to heroin. Marijuana, 3 times more likely, cocaine, 15 times, and people that use opioid painkillers are 40 times more likely to be addicted to heroin. So the population at risk: people who are addicted to prescription opioids or non-prescription opioids, you can buy them on the street. People who are addicted to cocaine, people without insurance, non-Hispanic whites, males, people who are addicted to marijuana and alcohol, and people living in large cities, and 18 to 25-year-olds. So we have short-term effects after ingesting or shooting heroin. So your arms and legs feel heavy. You have dry mouth, severe itching, nausea, vomiting, warm, flushed skin, slow breathing and pulse, and slow thinking. So these effects are the short-term effects, but they can last for several hours. So long-term effects. So long-term use of heroin can contribute to a variety of health issues that can be persistent and in some cases permanent. So constipation and stomach issues, lung issues, increased risk of pneumonia, especially if it's smoked, kidney or liver disease and damage, altered or irregular menstrual cycles for women, and sexual dysfunction in males. So signs and symptoms: I'm going to go through a few of these, money and privacy and money issues. You might find drug paraphernalia laying in the trash can. There may be sudden weight loss. So heroin affects the user's appetite and acts as a suppressant, but as opposed to normal dieting, a heroin addict's appetite will disappear so suddenly that they will simply stop eating. So physical symptoms, if they're smoking it, they may have sores on their lips and nostril areas. This is because the heat of the heroin smoke will irritate these areas. They may also have burn marks on their fingers, even their mouth area. Nosebleeds if they're snorting it, and of course if they're injecting it, you may see needle marks on their arms and their legs. Constipation and cramping. So look for consistent long trips to the bathroom. They will likely be trying to pass stool. One of the side effects of opioids is opioid-induced constipation, and this is also very common in heroin addicts. Issues with speech and coordination. Sometimes they may sound like they're mumbling, and other times you may not be able to understand them at all. Of course, we have deceptive activities. They're trying to hide things. Lung problems, especially if they're smoking it. They may have more frequent colds. They may have pneumonia and things like that. Mood swings, withdrawal, and of course, flu symptoms. If they're going through periods of withdrawal, a heroin addict will experience severe physical ailments. Often these come in the forms of symptoms of the flu. So overdose potential. In 2020, heroin-involved death rates decreased nearly 7% from 2019 to 2020. However, more than 13,000 people died from drug overdose in the United States. The number of heroin-involved overdose deaths was nearly 7 times high in 2020 than in 1999. So you can see it is on the rise. And nearly 20% of all opioid deaths involved heroin. So suicide is a weapon of choice. A lot of times this is impossible to differentiate between accidental and suicide. A lot of times the manner of death by heroin is undeterminable. The diagnosis can usually be made if they left a farewell letter or said to someone that they're gonna kill themselves. But otherwise, it's not possible to determine. So the detox facility I work in, we do a care plan when they come in. It's an inpatient program. We send them after their 28 days. We do send them to another facility for aftercare. We do individual counseling, group counseling, and addiction treatment therapy. So pharmacological treatment, we use buprenorphine, which is an opioid agonist used for treating withdrawal. We also use clonidine, which reduces the symptoms with withdrawal. It reduces the tremors, the restlessness, the agitation a lot of times, and the insomnia. And we give them Ativan according to the severity of their withdrawal. And of course, sometimes we have to Narcan them when they first come in. Methadone is usually given as an outpatient, not as an inpatient treatment. Non-pharmacological treatments, psychotherapy, therapeutic communication, education, and needle exchange. The city that I live in, we do have the needle exchange program. We do have a really high rate of heroin users here. Of course, Narcotics Anonymous, we do sexually transmitted screenings when they first come in, labs, vaccinations, COVID testing now. Patient education. We like to educate the patients that heroin withdrawal begins about 6 hours after their last ingestion, peaks around 3 to 48 hours, and can last 4 to 5 days. We do give them Suboxone after 48 hours of their ingestion, because if we give it to them any sooner, it will put them in a precipitated withdrawal, which sometimes can be worse than the withdrawal that they're going through. Medication, we give them medication, can help with the cravings. We educate them on inpatient treatment, outpatient treatment, counseling, peer support groups. We do education on their medicine, especially the Suboxone. It's sublingual under the tongue. For women that are pregnant, we educate them that they cannot take Suboxone, but we do give them the buprenorphine, which does not have the naloxone in it. And of course, safe storage of medication. So referrals, inpatient, outpatient, IOP, your intensive outpatient, methadone clinics or Suboxone treatment clinics, psychotherapy, and social services, because a lot of our patients are homeless. The methadone clinics, we educate them that the methadone clinics they have to go to on a daily basis every day. This is why they don't like to do the methadone. The Suboxone treatment is usually a weekly treatment where they monitor your urines. Follow-ups, of course, daily at the methadone clinic, weekly at Suboxone, weekly urine testing, and collaboration with counselors. So in order to be successful, the initial stages of drug treatment, whoops, I'm sorry. I have to go back one. There we go. Are designed to help clients. We want to establish medical and psychological stability, reinstate a healthy mind, outlook, and regime, understand their condition fully as well to manage them in a healthy way, and develop a detailed plan for ongoing treatment. So one of the things we do like to educate our patients on is that they think because they're heroin addicts, they're never going to recover from this. There is hope and there is help for them. And we do have several clients that were successful in their recovery. Thank you, everybody, for listening and watching my PowerPoint.